Assalamualaikum. My name is Wan Irina Syaira binti Wan Yuzaki and my matrix number is 081112. So I'm going to present about cardiomegaly. So first thing first, what is cardiomegaly? Cardiomegaly is known as enlarged heart caused by muscle thickening or the chambers stretched because the heart is working too hard to pump blood. As you can see by the comparison X-ray image that I have put on my slide, the normal heart image versus the cardiomegaly heart image. You can see the cardiomegaly is enlarged. So next, for radiographic appearance, what can you see in a cardiomegaly X-ray image? You can see an enlarged heart shadow. Next, you can see left atrial enlargement, and after that you can see there's a double right heart border. As you can see by the image that I have put, there is two lines on the right side of the heart. Okay, so next, a projection that we can use to one of the projection that we can use to identify cardiomegaly is the PHS projection. So before we start with placement, we're gonna talk about the projection first. So this is a PHS X-ray because thoracic vertebrae and posterior ribs are seen through the heart. Second one, scapula are outside of the lung field, and the third one is 7 thoracic vertebrae is at the center of the exposure field. Next, let's take a look at the anatomy that can be seen in PHS X-ray. First is the trachea. And next, right costophrenic angle, we can see left costophrenic angle, clavicle, left atrium border, right atrium border, left hemidiaphragm, right hemidiaphragm, ribs, and the last one is the heart. Okay, let's start with placement. The first in placement is P, that stands for positioning. So the first thing in positioning is the shoulders and posterior ribs are at equal distance from image receptor. The next one is chin is elevated and is outside the collimated field, which is important so that it doesn't superimpose with important anatomy that need to be seen in chest PA X-ray. So, and the last one is mid-coronal plane parallel with image receptor. That means that the patient body is not rotated. Okay, next for placement is A, that stands for alignment. So first in alignment, that is X-ray tube and patient is centered at T7. For X-ray tube and image receptor, it cannot be determined due to no four-sided collimation. The same goes as image receptor and patient. And next for placement is collimation, which is the superior border should be 5 cm above the shoulder. The inferior border should be at least include the 12th rib, and the lateral border should include the skin margins. This radiography got adequate collimation since there is no cut and it follows the collimation that is stated. And the center ray is at T7 but there is no four-sided collimation. The next for placement is exposure. For PHS, we need to use 100 to 110 kVp and 4 to 8 mLs. So the kVp for this PHS X-ray is good because the cortical outline at the thick structure, thoracic vertebra, and thin structure of vascular lung markings can be seen. And the MAS is good because the bony trabecular pattern at the thick structure, thoracic vertebra, and thin structure of air-filled trachea can be seen. And then we move on to the marker. There is a marker that indicates the left side of the chest and it is not superimposed with important structures. And for the aesthetics, the film size is 35 times 43 cm that is placed lengthwise, and there is no motion evidenced by sharp bony margin of the X-ray image. And the last one for placement is name. So the name of patient, the ID, and the clinical name are not available in this X-ray, and it should be located at the bottom corner of the image. So in conclusion, I reject this PHS X-ray because patient ID is not available. Okay, next, another projection that you can use to detect cardiomegaly is by using lateral chest X-ray projection. So, first thing first, before placement, we will start with the projection. This is the left lateral chest X-ray because the entire lung field is included within the collimated field. The second one, the mandible is not evident in the image and the sternum is in profile. So for the anatomy that need to be included in this lateral chest is the lung apophysis, the scapula, sternum, the esophagus, the trachea, heart, costophrenic angle, thoracic vertebrae, posterior ribs, and also the diaphragm. Okay, so we move on to placement. The first one, that is positioning. So for positioning of the lateral chest, the right and left posterior ribs are nearly superimposed. The second one, the forearms are not superimposed with regions of interest. That means the patient's arms are elevated on top of their head. And the third one is mid-sagittal plane is parallel with the image receptor. And the next for placement is the alignment. So first thing in alignment is the X-ray tube and patient that is centered at T7. And for X-ray tube and image receptor, it cannot be determined due to no four-sided collimation. The same goes to image receptor and patient. And next, the C in placement stands for collimation. The collimation for lateral chest superior border should be 5 cm above the shoulder. The inferior border should include the 12th rib, and the lateral border should not cut the skin margin. Okay, so this radiography got adequate collimation, and the center ray is at T7, but there is no four-sided collimation. And next for placement of the lateral chest is the exposure. The exposure of the lateral chest is 100 to 110 kVp and the MIS is 8 to 12. So the kVp for this X-ray image is good because the cortical outline at the thick structure thoracic vertebra and thin structure of valvular lung masking can be seen, yeah. And the MIS is good also because the bony trabecular pattern at the thick structure thoracic vertebra and thin structure of air-filled trachea can be seen. And then next, for the marker, there is a marker that indicates the left side of the lateral chest, and it is not superimposed with any important structure. For the aesthetics, the film size is 35 times 43 cm, and it is placed lengthwise, and there is also no motion evidenced by the sharp bony margins. The last one for placement of the lateral chest is the name. The name of the patient, register number, and clinical name is not available in the image, and it should be located at the bottom corner. So in conclusion, I reject this lateral chest X-ray because the patient ID is not available, yeah. So for cardiomegaly, that is all from me. Thank you so much.